Hi there, this is Aroop, one of the Menlo Park vloggers, and I'm back for my second video. In this video, I'm really going to be focused on the things required for GP training in terms of the portfolio. So, the first question is how is GP training assessed? I think the simple points really is that the portfolio that you find on a website called 14 Fish is the mainstay of assessment, and it's sort of looked at every 6 months by a panel. It involves adding clinical cases, audio cases, and there's a heavy focus on reflection. There's also room to be doing a quality improvement project. For example, I've done one on chronic kidney disease in the GP practice, and whether patients are appropriately monitored, coded, and I'm seeing whether a change to our practice guidelines would lead to an improvement in patient care. So that's something that I'm doing. On the 14 Fish portfolio, you can also add any other academic achievements or involvement that you've had. Personal level, I've been engaged with medical student OSCEs and other forms of teaching, which I can also add to my portfolio. So the AKT is an assessment that needs to be passed in your GP training. It stands for the Applied Knowledge Test, and it's a summative assessment that you either take at the end of ST2 or at the beginning of ST3. A lot of candidates like to do it at the end of ST2 because ST3 is so packed and there's many other things to be getting on with. The actual assessment involves 200 questions based on clinical medicine, evidence based medicine, and health informatics. It's a computer based exam, it's multiple choice, and I think it's a very good indicator of knowledge that's required within a general practice setting. So the RCA is the final summative assessment. You tend to sit in ST3. It stands for the Recorded Consultation Assessment. At the moment, what a candidate has to do is send in 13 recorded consultations with patients, which where you're meant to display good interpersonal skills, good clinical knowledge, and generally, demonstrate that you're a well-rounded individual to become a GP. The recordings get assessed by a panel of examiners. I think it's multiple panels actually, and then they just give you a grade. Once you pass that, that usually leads you to CCT in GP.